Hi my loves, and welcome back to a brand new video today. Welcome to my YouTube channel, Health by Hirsch, where we discuss all things perimenopause, menopause, and hormone replacement therapy. This video, we're gonna be talking about progesterone intolerance. What the heck is it, and how do I know if I have it? So if this is something that you're wondering about, you've clicked on because you're like, I think I'm having some side effects to my hormone replacement therapy I just started, or I wanna know what those could potentially be, this is a great video for you. If you don't know me, I'm Dr. Heather Hirsch. I'm a board-certified internist. I completed Advanced Women's Health Fellowship from the Cleveland Clinic in 2014 to 2016, and I've spent the last decade plus just treating women through the perimenopause to menopause transition. I have a podcast, I'm an author, and I also have a private telemedicine practice. We're open in almost all 50 states with the most amazing clinicians that I helped to train. And I also have the Heather Hirsch Academy. This is a place where if you're a provider, a clinician, or a healthcare professional, you can go to learn all of this stuff because I don't want to be out here alone. If you want in on that, check the links in the description below. So let's talk about what is progesterone intolerance. Well, truth be told, there is no textbook about progesterone intolerance. As clinicians, we're lucky if we learned anything about hormone replacement therapy, perimenopause, and menopause, so there really is no great textbook. However, most of us who are menopause experts, clinicians, we definitely see something called progesterone intolerance. What this basically is side effects to progesterone. Now, maybe not all progesterones. Where we see this the most is to the beloved micronized natural progesterone or bioidentical Prometrium, the FDA approved, capsule of Prometrium that you could get at CVS, Walgreens, Rite Aids, or your local pharmacy. Now, why is it primarily with this? We don't really know. It probably is because it actually can get through that blood-brain barrier and cause some CNS symptoms. And we know that progesterone has a role in slowing things down. I'm gonna get to all of that in just a second. So let's talk more about what is progesterone intolerance and what are those side effects. This is so fascinating. If you didn't know what the main role of progesterone is for the human body is actually to sustain a first trimester pregnancy. Yeah, without progesterone, we wouldn't be here. You wouldn't be watching this YouTube video. Progesterone acts like the placenta until it's formed at the end of the first trimester, beginning of the second trimester. So if you think about pregnancy, if you've ever been pregnant or if you've seen your friends be pregnant, you know that first trimester of pregnancy, you kind of have that, chill Netflix on the couch vibes. You're not even big and pregnant yet. In fact, it's so interesting, right? That women, when you're pregnant, are full of energy in their second and third trimester. And that first trimester, when you're not even showing, this is when you have a peak of progesterone. What does it do? It causes you to feel really relaxed, right? And it also is slowing digestion. Why? Because it wants to absorb all those nutrients and give it to that growing fetus to protect it so that you can have a successful pregnancy. So when we're taking progesterone in, either perimenopause or postmenopause, it can still have those same effects. Now, definitely the levels should not be as high as pregnancy. That's really high, but this can sometimes be a clue as to if you're gonna have some progesterone intolerance. So progesterone can cause some sedation. It can cause slowing of the GI system. Progesterone relaxes those smooth muscles as a way to get all this beautiful blood flow to all the organs that need to be working well to grow this fetus. All right, so when we try progesterone for women in perimenopause or menopause, we are doing this for a couple of reasons. The first is safety. If you're a woman taking estrogen and you have a uterus, especially if you're postmenopausal and you're no longer making any of your own progesterone, you do need to take progesterone with that estrogen to decrease any risk of uterine cancer. I do have many videos on that. The main thing to know is you do need to be taking an FDA-approved progesterone. Okay, so what are the positive effects progesterone can have? Well, it can help decrease anxiety. It increases the production of GABA. That's the neurotransmitter that makes us feel a little sedated and tired. It can help with some insomnia. It can help you get to sleep nice and snugly. So there's the two things that progesterone is doing. It's necessary if you're on estrogen, and for many women, it can have some positive benefits. But we're here in this video to talk about progesterone intolerance. Some women, these are not welcomed side effects. These are, in fact, bothersome side effects. So what kind of symptoms could you have? Well, you could have where you feel too sedated. You could feel lightheaded and dizzy. I've actually had a patient who had to call 911. After she took Prometrium, she felt so dizzy, she fell, and she was really, really nervous and anxious. Now, good news, by the time they got there, she was just a little tired, and she said, I probably fell asleep, but it made her really, really scared, and she was very, very sensitive to Prometrium. It made her so dizzy and so sedated. Some women find the next day when they wake up, they're also just feel like a little hungover or tired. And these are not things that we want you to have. The goal of hormone replacement therapy is for you to feel better, not take 2 steps forward, 3 steps back. So those can be some signs of progesterone intolerance. Some women also find that the Prometrium makes them feel moody. It actually makes their mood worse. It doesn't necessarily decrease anxiety, it might increase depression. We don't really know why this is. But if you can think back to your menstrual cycle, if you did get a lot of depression when you were having PMS or when you were having fluctuations in progesterone, this could be a clue that you might have a similar symptom if you try progesterone. Some women also find that they get GI side effects, water retention, constipation, and then bloating. And again, why is this? Because progesterone is supposed to slow the digestive tract. It just does it more than you want it to. Some women will also find that this water retention is so much that they feel like they can't get their rings on, or they step on the scale and they say, Dr. Hirsch, I gained 5 pounds or 10 pounds. It's usually not adipose tissue. It is usually water retention. And these are some of the main symptoms women can get with progesterone intolerance. Now, what are the statistics of getting progesterone intolerance, especially from Prometrium? Well, in my clinical experience, and I've been doing this for now I can say more than a decade, I see about a third of women, even though I just gave you this list of side effects, really, really like Prometrium and the progesterone. Why? Because they feel like it calms the anxiety. It kind of calms them down. It feels like a miracle. In fact, they'll tell me it feels like someone just wrapped me in a warm blanket, Dr. Hirsch, right? About a third of women will actually have no side effects. They won't either have any major benefits, but they won't either have any things that bother them. They just take it for that safety reason, right, that I talked about before. And about a third of women seem to have some side effects. And of this third, I see about a third that are mild, a third that are moderate, and a third that are severe. So if you're having milder symptoms, what can you do? Well, sometimes my patients just take it less. They may take it every other night, or they may try using it inside the vagina, which is more of a transdermal absorption. Yes, that's transdermal, versus oral and taking the pill orally. And that can kind of help so that they don't have those symptoms really build up and then become so bothersome. My patients with mild and especially severe progesterone really have to try a different form of progesterone. Now, note here, you're going to ask me, what about using compounded progesterone? Well, very rarely I will compound it in an oral form. It's not FDA approved. And remember, as a clinician, I'm always thinking about the safety of your hormone therapy regimen and making sure the uterus is staying safe and healthy. Now, big caveat, if you don't have a uterus, you don't have to take progesterone. So if you have no uterus and you fall into this, a third of women who have side effects from progesterone, just take it right out of your regimen. You do not need it. But now back to compounded. There is compounded progesterone creams, which I do not recommend. Why? Because they do not absorb well through the skin. Those are also not FDA approved. And a lot of the reason why patients will tell me, well, when I use the cream, I don't have as much of the side effects because it ain't absorbing. And so if it ain't absorbing, of course you're not having the side effects, but you're also not getting any of that progesterone absorbed to keep the uterus safe. Now, if you fall in that moderate to severe, I do have some other YouTube videos here with a deep dive on other forms of progesterone. There's other things that you can do to protect the uterus, including different formulations of progesterone. You could use an intrauterine device, and therefore the progesterone stays locally in the uterus and does not travel systemically. So you will definitely have less of those CNS symptoms like the sedation, the moodiness, and those GI effects like the bloating and the water retention if you have an IUD. And there's a medication called Duave. I have a whole video here on Duave all about why you can use this, because it is actually not progesterone. It's 2 medications, estrogen and basidoxifene, and that basidoxifene protects the uterus and you don't have to take a progesterone. But this video here is all about how do you know if you have it. Truthfully, progesterone intolerance is pretty quick acting. After a few nights, if you're starting to feel these symptoms, you've got some mild, moderate, or severe progesterone intolerance. It's not going to take you weeks or months to determine this. However, and this is my last caveat, this is why I teach all my clinicians, and at the collaborative, all of our clinicians do something called hormone stacking. What is hormone stacking? Well, if you're going to be taking a hormone therapy regimen, it may include the trifecta of estrogen, progesterone, and testosterone. It may not. I have some women just on estrogen who don't have a uterus. I have some women just on testosterone who don't feel like they need estrogen, progesterone yet. I've got some women on the trifecta. There's all different forms. And again, it really depends on what organs you have and what symptoms are bothering you and if you're perimenopause or menopausal. But when women have side effects to their hormone therapy, it's usually to one hormone, not two and not all three. And so it's really important to determine if you have progesterone intolerance to stack. So maybe you're going to start with progesterone and you do that for 2 weeks to make sure you don't have any intolerance. If you're good, then you add the estrogen. You do that for 2 to 4 weeks. And if you're good, then you add the testosterone. That is one form of stacking. I'm just kind of making that up, right? Or let's say you started an estrogen in really early perimenopause, and then you did that for 6 months, and then you added the progesterone. You could definitely see if side effects started then. So way back, even in my career, I used to prescribe all of these hormones and start them at once. And I have since realized that hormone stacking is a fundamental principle to getting HRT right. It's actually not that hard to do. And again, if you're a clinician, you want to know my reverse engineer your HRT by menopause type and hormone stacking method, definitely check out the course at the Heather Hirsch Academy. But if you are a patient and this makes sense to you, absolutely go to your doctor and say, I think I should start one at a time. It's the Heather Hirsch hormone stacking method. Let's just start a trend here. So that's how you can also tell if you have some progesterone intolerance. I tell you this story because I did have a patient who came to me already on all three, and she was having some moodiness. We weren't sure if it was because the estrogen was too low, was the progesterone too low, was the testosterone too high? We made a lot of adjustments and it wasn't going away. Ultimately, I thought, let's stop the progesterone for 2 weeks and see if it resolves. Boom, it did. And so this is why actually, sometimes we'll have to reverse engineer your HRT. If you are having a symptom, it's usually one of those hormones, not all three. All right, guys, I hope you found this video on progesterone intolerance really helpful. If you love progesterone, don't like progesterone, or if you have no impact, comment below because you're going to see, let's do a quick little experiment, if it's about a third, right? I think that would be really, really fun. If you love this video, please like, subscribe, and hit that bell to never miss a new video when they drop. Also, if you're interested in becoming a patient at the Collaborative by Heather Hirsch, or if you'd like to be a student at the Heather Hirsch Academy, please check all the links below. I'd love to work with you. Also, if you want to work with me, but none of those seem right, you can just also check out my book, Unlock Your Menopause Type, for women in menopause. Thank you guys so much for watching. Thank you for helping me grow this incredible channel in this little cozy corner here on YouTube. See you guys next week for a brand new video. Bye, guys.